Good afternoon, one and all. Myself, Dr. Rupasri, Obstetrics and Gynecology. I'm a consultant at Hyderabad. Today, I would like to present a small topic. Okay, let's be very short and sweet. We'll discuss only some of the important things of the fetal skull, like what are the regions of the fetal skull, areas of the fetal skull, what is known as sutures, what is known as fontanelles. Okay, if you all want to take the notes also, no problem, you can take it. Okay. Okay. Fetal skull. What is fetal skull? Skull means it is a bony encase. Okay. Okay. Skull means it's a bony encase for protecting the brain. Okay. In this slide, we are going to see what are the regions of the skull. Okay. And fetal skull is made up of in flat tabular bones. Okay. Now we'll discuss about the regions of skull. Okay. See, what are the regions of the skull? See, this is the vault, and this is the face, and this is the base. Okay. What is the vault? It is an imaginary line, imaginary dome-shaped line extending from the supraorbital ridges to the occiput. Okay. See, this is the dome shaped. See, this is the dome shaped, and it will be extending from here almost the supraorbital region to that of the occiput. Okay, this is the region number 1. Next one. Second one is the face. See, it extends from the supraorbital region to that of the base of the floor of the mouth and the neck. Second one is the face. It extends from supraorbital ridges to the junction of floor of mouth and neck. And last is the base. This is the third one. It protects the vital structures. Vital structures of brain, like medulla oblongata. So, what are the regions of the skull means? First point, that is vault, and next is the face, and the other thing is the base. Okay, these are the 3 regions of the skull. So, what are the questions they will be asking? MCQs means, see, regions, extension. From where to where may be the questions. Okay, they will be asking the questions, and it is made up of flat tabular bones is also a question. These are 2 questions in this. And we'll go to the next slide. Now, areas of the skull. What are the areas of the skull? See, there are 3 areas of the skull. One is vertex, the vertex, it extends from here to the here. I'll say from where to where. Okay, this is the vertex and this is the brow and this is the face. Okay, vertex. It is quadrangular in shape. Quadrangular shape extends from anterior fontanelle or bregma. Okay, anteriorly it extends from anterior fontanelle or bregma to occiput or lambda sutures. Okay, see, it extends from the anterior fontanelle to that of the lambda or lambdoid sutures behind. This is the vertex. Now the second, that is the brow. It extends from the supraorbital ridges. It extends from anterior fontanelle or bregma to that of the supraorbital ridges or root of nose. Okay? See. Till here it is the vertex. From here, that is the anterior fontanelle or bregma to the root of the nose is the brow. Third one, now see the extension of the face. It extends from the root of the nose and supraorbital ridges to that of the junction of the floor of the mouth to the neck. Extends from the supraorbital ridges or root of nose to junction of floor of mouth and neck. These are the three important areas of the skull. Okay, what are the questions that can be asked here? See, what is the shape of the vertex? This is the first question. Important. Extension from anterior fontanelle or bregma to the lambda or lambdoid sutures. It is the second question. They may be asking what is the brow, what is the extension, and what is the face. Okay, these are the questions. These are the questions they will be asking in your MCQs. And other thing is, we'll see some of the important points of the skull like sinciput. It is a area corresponding to brow. Okay, it is the sinciput. And next we'll see other important points like occiput. Occiput means it is a projection posteriorly. That is, it is an important point present at the lambdoid suture. Area corresponding posteriorly to the occipital prominence. Area corresponding posteriorly to occipital prominence or lambda sutures. Okay. Third one, mentum. It is the chin of the skull. Chin part of the fetal skull. Okay. And submentum is just below. That is just at the junction of the below the chin at the junction of floor of mouth and neck. Okay, these are some of the important areas which can be asked. And see, they'll be asking, what is sinciput? Means it is the area corresponding to the brow. What is the occiput? Means it is the area corresponding near the lambdoid sutures. They will be asking these questions also. Okay, these are short one-liners. Mostly they will be asking in the DNB because anatomy part will be having more questions in case of DNB. Okay, what is mentum? What is the segmentum? These are the just small definitions. If you remember these now, it will be very easy for you to remember the diameters of the skull, which will be discussing in the next coming videos. Okay, let's be small, okay, short, sweet with little topic. And the next slide. Now we'll come for sutures. What are sutures? And first slide I have said that fetal skull is made up of non-ossified membranes. That is, all the bones of the fetal skull will be joining by some non-ossified membranes. Non-ossified membranes. These are called as sutures. Okay, we'll see how many sutures are there completely. Four sutures. Okay, we'll see. See, this is the this is the frontal bone. Okay, this is the parietal bone, and this is the occiput. Between two frontal bones is the frontal suture. Between two parietal bones is the longitudinal or sagittal suture. And see, this is the occiput. These are the lambda sutures. Okay, lambda sutures. And between the frontal and the parietal, these are the coronal sutures. Okay, this is the coronal sutures. Okay, there are four sutures. Between the two frontal bones is the frontal suture. Between the frontal and the parietal is the coronal suture. And between the two parietal bones, it is the longitudinal or sagittal suture. And between the parietal and the occiput is the lambda suture. Okay, now why these sutures are present? What is the importance of these sutures? Okay, means we'll see what is the function or importance of sutures. First point. Okay, what is the importance of the sutures? It helps in easy passage of fetal skull through the resistant birth canal. Okay, you all know that the birth passages will be very tight. It will take very long time. While gradually the fetal head will be descending means, see the sutures, it will be helping in easy movement of the fetal skull through the resistant birth canal. Second point, on internal palpation. Internal palpation means per vaginal. Okay, while palpating the sutures, palpation of sutures helps us to know, first point, manner of engagement of fetal head. Okay, how means Manner of engagement means in which diameter does the fetal head is engaged. Is it subbregmatic, suboccipitobregmatic, or suboccipitofrontal? It will be helping us to knowing that what is the manner of engagement of the fetal head. Okay. Second point, it helps in knowing degree of flexion of the fetal head. Okay, how much is the flexion of the fetal head? On palpation, we'll be knowing on palpating the sutures. Third point is and degree of internal rotation. Internal rotation. Why I'm writing everything, every point clearly because if you have time, please take down the notes also. Okay, the class will not be more than 50 to 20 minutes. Okay, you can take the notes also. I'm writing it very clearly. And next, okay, you have taken what are the important questions they will be asking you in this is first point. What is the importance of sutures? They'll be giving all what is the true statement regarding it or all are the true statement except. So it helps in easy passage of the fetal skull to the birth canal and on per vaginal examination or while palpating the sutures, we'll know the manner of engagement of the fetal head, flexion of the fetal head and internal rotation of the fetal head. What all I'm speaking may be the MCQs for you all. Okay. Next. Now the last is fontanelles. What is this fontanelles? Now what is this fontanelles means? See, the wide gap present. See, I have said that these are the suture lines. Okay. The wide gap in the suture lines is a fontanelle. Wide gap in sutures is fontanelles. Okay. There are two means important are two. Actually three. Three fontanelles. Okay. See. This is the anterior fontanelle. This is the posterior fontanelle. And other is just the sagittal fontanelle. It is of not much clinical importance. I'll say we'll speak about the differences between the anterior and posterior fontanelle. Anterior fontanelle and the posterior fontanelle. Therefore, this is the anterior fontanelle and this is the posterior fontanelle. Okay. Anterior fontanelle is also known as bregma. See, it is bregma, anterior fontanelle. It is diamond shaped. It is a diamond shaped. Third point is anteriorly it is bounded by the frontal suture. Anteriorly by the frontal suture. Okay. And posteriorly by sagittal suture and laterally by the coronal sutures. Coronal sutures. And the diameter, it is diamond shaped. See, this is the diamond shaped. Fourth point, anterior, posterior or the transverse diameters are same. 3 into 3 centimeters. Okay, 3 into 3 centimeters. And fifth point is it is ossified by 18 months. It is ossified by 18 months and if not ossified by 24 months, It is pathological. Okay. It should ossify by 18 months. If it is not ossified by 24 months, it is pathological. Okay. Now we'll come exactly to that of the posterior fontanelle. By seeing what only you can see. Okay. See. By seeing only you can see. Anterior fontanelle and see. It is also known as lambda or lambdoid point. Posterior fontanelle is also known as lambda. This is bregma. This is lambda. This is diamond shaped and now you can see it is a triangular shape. Triangular shape. Okay. Now third point. Anteriorly it is bounded by the sagittal suture. On sides by the lambdoid sutures. So anteriorly by the sagittal suture. And on lateral sides by lambdoid sutures. Okay. Now the fourth point is anterior, posterior and transverse is same 1.2 into 1.2 centimeters. Okay, 1.2 into 1.2 centimeters. Now the fifth point is it is ossified by term. Okay, it is ossified by term. These fontanelles are very important. Okay, I will discuss it again for you all. Okay, this is the anterior fontanelle, this is the posterior fontanelle, and the third one is sagittal. It is located on the sagittal suture. No much clinical significance. No much clinical significance. Okay, it is situated just on the sagittal suture. Therefore, it is known as sagittal fontanelle. No much clinical significance. They will say that it is on anterior 2/3 and posterior 1/3, but it's not so prominent there. So that it is not of much clinical significance. Therefore, see, it is a wide gap in the suture lines. Wide gap in the suture lines is the fontanelles. Three fontanelles are present. That is the anterior fontanelle and the posterior fontanelle. This is a bregma, diamond shaped. This is a lambda, triangular in shape. And this is of 3 into 3 centimeters anterior fontanelle. Posterior is 1.2 into 1.2. Anterior fontanelle is ossified by 18 months. And posterior fontanelle is ossified by term. Okay. Questions in this are definition of fontanelle, shape, diamond shape or triangular shape, and ossification. These are the questions they will be asking. Okay. Now, the importance of the fontanelles. We came to the end of the topic, that is importance. If some point is present, there should be some significance or some importance regarding it. Okay. See, let us see now the importance. First point. It denotes the flexion of the fetal head. Means while palpating, while doing PV, if we feel any diamond shaped part, oh, still the anterior fontanelle is there. Or if we feel any triangular shape, we'll observe, oh, the posterior fontanelle is present. So the engagement be like this. So the flexion may be like this. So it denotes the flexion of the fetal head. It denotes the molding of fetal head. And after the birth of the baby, what happens is the brain continues to grow up to 1 year of life. So, these fontanelles help in accommodating the brain growth. It helps in accommodating the brain growth. And the last point is these fontanelles help in collection of blood, cerebrospinal fluid CSF, and help in exchange transfusions also will come regarding this in the coming topics. Okay, what is exchange transfusion and all, why we'll do all these things. Okay, will come in other topics. Okay, what are the important MCQs they will be asking is, see, what is the importance of the fontanelles? Okay, it denotes the flexion of the fetal head, molding of the fetal head, helping accommodating the brain growth. Means how they'll frame the questions means regarding the fontanelles. What is the important point? What is the correct point? Or regarding the fontanelles, all are true. Okay, but one is false. Some assertion. It is so and so. It is so and so reason. While the reason is expressing the assertion or not. These are the points which will be helping you in distinguishing all the conditions. Okay. Now in this video we have learned first point, that is the regions of the skull, wall, face and base. Second is the areas of the skull, that is the vertex, brow and next is the face. Next we have learnt about the sutures. There are four sutures. Fontanel, that is the frontal suture, coronal suture, sagittal or the longitudinal suture and the lambdoid suture and their importance. Next, fourth point is the fontanels. Wide gap in the suture lines is the fontanels. We have read regarding it. Anterior fontanel and the posterior fontanel, its importance. Okay. In coming topics, we will be discussing about the same condition with the fetal skull and the diameters of the fetal skull. Okay. I think this video will be helpful to you, and I am ending the session here. Okay. Thank you.